Experts say in order to draw attention to the unlimited opportunities that vaccines offer humanity in saving lives, especially the vulnerable children, strengthening immunization services and systems must be accorded priority. To this end, the National Primary Healthcare Development Agency says it is ready to carry out a mass vaccination of children in all parts of the community throughout the 2019 African Vaccination Week. Kevin Balogun has details.
The African child from vaccine-preventable diseases cannot be overemphasized. The administration of a vaccine stimulates the body's own immune system in order to protect the person against subsequent infection or disease. This is the 9th African Vaccination Week with the theme Protected Together, Vaccines Work.
We know that immunization is the entry point for strengthening routine immunization and really building a resilient health system. The vaccines are safe. They are WHO, World Health Organization, pre-qualified, they are NAFDAC pre-qualified, and these vaccines are free.
All hands must be on deck to make sure that our children, the last child, is not forgotten. We need your help as journalists. We need the help of advocates, as we saw. We need the help of the government. We need all of us coming together. It's only when we are together that we are fully protected.
Available statistics confirm that due to the selfless commitment of vaccine heroes, a total number of 116.2 million children were vaccinated and saved from vaccine-preventable diseases all over the world in the year 2017. This is the highest figure ever reported.
For the very first time in Nigeria, we're seeing a consistent and compelling improvement in the number of kids that we're reaching with life-saving vaccines. What is happening now is that global experts are looking at what we're doing in the immunization space in Nigeria and saying that this has never been done. We have surpassed all historical expectations when it comes to moving from very poor routine immunization indicators.
In Africa, 1 in 5 children still do not receive all the necessary and basic vaccines. Coming down to Nigeria, many children still miss out on vaccination, particularly in the poorest, marginalized and conflict-affected communities, due to the lack of awareness and knowledge of caregivers on immunization-related issues.
We are also mindful of the fact that in some areas, not just the northeastern areas, but areas where there are insecurity, it's kind of hard for us to reach those kids. We've worked with local leaders, with traditional leaders, religious leaders, opinion leaders, NGOs, CSOs, to understand those communities and see the best ways of delivering those vaccines.
Immunization remains the cheapest and yet the most effective life-saving health intervention to all children in human history. Kemi Balogun, TVC News, Abuja.